So it gives me great pleasure today to welcome Dr. Sonia Karani, who's a PhD researcher and physiologist at ASV Santé and the Pediatric Non-Invasive Ventilation and Sleep Unit at the Necker University Children's Hospital in Paris, France. Welcome, Sonia, and she's going to be giving us some top insights into the considerations about choosing equipment in children. How do you choose the right ventilator for the right patient?
So to answer the question, first we'll go through the different type of ventilator that are available with the description of each type of ventilator for CPAP or NIV. They can be called because there is no standardization of name, but like a standard ventilator or level 1. This is how we call them in France. This is level 1 ventilators. And this is example of a ventilator. Obviously, a lot of other ventilator exists. So what are the advantages of these level 1 ventilators is that they are small sizes. They can do, for many of them, only CPAP ventilation. For some of them, CPAP or NIV. The CPAP devices will do both constant CPAP or auto-set CPAP, while the NIV level 1 ventilator will do only constant CPAP and obviously NIV with different modes of ventilation. So they have small sizes and they have built-in humidifier, as you can see, for example, here. This is inside the ventilator. That was nice. This is hidden inside. This is here and this is here. But what are the inconveniences of these ventilators is that they don't have internal battery. So if you remove the plug, you won't have electricity and then the ventilator will stop. They have a flow detection of the patient that is around about usually 30 kilograms for CPAP ventilators and above 13 kilograms for NIV level 1 ventilators. So the manufacturer are talking about weight of the patient, but the problematic is not exactly the weight of the patient, but the capacity to detect the flow of the patient. But anyway, until now, we only have some indication concerning weight of the patient. What that means? That means that if you don't have a flow detection, that means if your patient does not weight above this recommended weight, you won't have reliable data. Another problem is that if you are using CPAP level 1 ventilators, you won't be able to do auto-set CPAP if you are not weighting above about 30 kilograms, just once again because of a problem of flow detection. And another big issue to be aware of if you use this ventilator in small children is that you won't have any alarms for CPAP ventilators. You would have only a few ones for NIV ventilators. Then the second category is what we can call like intermediate, or in France, we usually say level 2 ventilators. So here are a few examples. Once again, you have a lot of different models, but not placed on the slide to share them all. The advantages is that they have a medium size. They also have the built-in humidifier. Here, for example, you can put here, for example, you can add one here. And here for this model. They have internal battery, about 2 to 6 hours of functioning depending on the ventilator. You can also add external battery. They have some alarms depending on the device. This vary a lot. This level 2 can all do CPAP, but it will be constant CPAP. And obviously, these are already considered like NIV ventilators. And they have some options, same thing, depending on the manufacturer and the model of a ventilator, you will have different kind of options. If you want to understand them, you have to ask, I think, or the manufacturer to explain you what are the different options, because sometimes they have different name to do the same thing than another model of ventilator. So, or you go through the ventilator just to try to understand what are these options, or you ask the manufacturer. The inconvenience, once again, is a question of weight, but much more of flow detection. So usually they are adapted for patients that are weighing more than 10 to 13 kilograms, meaning that usually if you are under this weight, you won't have reliable data. But what is interesting with this ventilator is that the size and the possibility are interesting. The third category that we all call life support ventilators, and also level 3 ventilators in France. These are some examples. They have the advantage to have a battery that are about 8 hours of duration. This is very important, obviously, as you know, because they are life support machines. And you can also obviously have external battery. They have a flow detection that is over usually 5 kilogram and 2.5 kilogram for this new ventilator. Meaning that these are ventilator that you can adapt easily for very small infants. They have a lot of alarms, once again, because you have to have alarms. It's important if you are ventilated, a patient has a life support. The inconvenience is that they are very big, except this one, which is recent. And they have an external humidifier. So that means that you have the humidifier that you have to put on the side with some different tubing. So important to know which kind of device you will use, and once again, what are the limitations, what are the positive points. And this is important to ask the manufacturer if you have some doubts, and to try to understand how they function, what are the different options before you start to use them on the patient, especially when this is new models of ventilator. So this is important to take the time to understand all the functions of these ventilators. So we talked already a lot of flow detection, but why is it so important to have a correct flow detection? Just because you will have, depending on how you are starting CPAP and NIV, are you seeing the child only at hospital with a lot of monitoring, or only during outpatient visits? It depends on the management that you will have. It depends obviously then on the country where you live, if the patient has to buy the devices or not, because the price are obviously not the same between the level 1 and the level 3 ventilator. There are a lot of problems that you have to be aware, but why is it important to understand if you will have a flow detection or not? Is just because if the ventilator can't detect correctly the flow, you won't have correct data, like the compliance of the patients. So this is important. If you want to follow the child only during an outpatient visit, you won't be able, if the child was using the ventilator really during like 11 hours, as the mom said, or only during 1 hour, as the ventilator said. And in that case, as you can see on this curve, the patient was not detected, so the ventilator, the software said that the use was only for 1 hour, while it was really during like 11 hours. So you have to be aware of that limitation. Another problem with flow detection is that if, as I said before, if you don't have a good flow detection, you won't be able to do auto-set CPAP, just because you need to see the flow, you need to see the respiratory events for the CPAP to increase. And so without flow, there will not be increase of pressure. You may have, and this is very, very important, for example, for children under CPAP, you will be able to use any ventilator, because even if you don't have the compliance, even if you don't have other data, you know that for constant CPAP, the ventilator will work. You will always have CPAP, and that will be okay. You won't have the data, but the device will work to give some pressure, to give the right CPAP pressure that you set. But if you are doing NIV, and if you are doing NIV with the possibility of the child to trigger the ventilator, you will have some big troubles if the ventilator does not see the flow of the patient, because the child won't be able to trigger the ventilation. So you have to be careful with this. And once again, you won't have correct data. That is also important, depending on the monitoring that you want to do. And another point is that you can have a lot of alarms that you can't inhibit, because the ventilator won't see the flow, and it can say, for example, that there are a lot of apneas of the child just because the flow is not visible or is always at zero, because the device is not capable of measuring correctly the flow. So once again, it's important to know which kind of ventilator you are using, what are the limits, what you want to do, what you need to get before choosing a ventilator. It's really important, and much more if you are doing NIV. So this slide will give you some tips about what we are using. Obviously, you have to do as you want, depending on your experience, depending on how you feel comfortable, but I will share with you what we usually try to adapt depending on the infants and the number of hours of use of ventilation. So concerning CPAP, if we are talking about infants, and the use of the CPAP is more than 16 hours per day, we will choose a life support ventilator with internal battery, because we feel more comfortable to have an internal battery, to have alarm. And that means that there will be an external humidifier that sometimes is not very nice for the parents, but we don't have a choice, because we'll go to true security. And once again, this is not because the infant need a life support device, it's just because he's very small and needs ventilation for a long period of time. If the CPAP is used only during night and or naps, you can either choose a life support ventilator if you feel very comfortable with this, or if you have the experience, try with the intermediate device. Once again, you will have internal battery, but of lower duration. You will have some alarms that are different, but you will have integrated humidifier. If we are talking about a child that need to use CPAP for more than 16 hours per day, we will choose usually intermediate device. And if it's only for night, or sometimes also for nap, we'll go either through intermediate device or standard CPAP. That means no internal battery and integrated humidifier. And concerning adolescent, usually we feel very more comfortable. So if it's more than 16 hours, we'll go with intermediate device, just because we are afraid sometimes that the standard CPAP device won't be capable of doing CPAP for so long time during each day, and sometimes it cannot be adapted to ventilate for so many hours every day. That's why sometimes we prefer to choose an intermediate device. And if it's only for night, maybe sometimes for nap in some adolescent, but usually it's only for night, we will go with a standard CPAP. Usually our practice is to propose the humidifier, but that can be a discussion. So this is another way to see what we are usually proposing for our patient. But once again, you have to do what you feel best for the patient and how you feel comfortable with. So this is only an indication of our practice. So concerning CPAP, if the child weighs less than 5 kilos, usually we feel more comfortable to use a life support device. And just because our way of functioning with monitoring that is mainly during outpatient visit will permit to have a good detection of the flow of the patient and to have reliable data that are very important for the management of the patient in our practice. If the child weight, and once again, this is approximative, but we don't have any other indication, but if the child weighs more or less more than 5 kilograms, we will go through intermediate devices, except if the child need to be ventilated for a long time, like we said, more than 12-16 hours per day, we will choose a life support device preferentially. Otherwise, we can try intermediate device, and many times we can have flow detection that is correct enough to have some data. And if the child weight more or less above 20 kilograms, we will go with standard devices, but if he needs to be ventilated for a long period of time per day, we will go with intermediate device. And what we can propose for standard devices, if the child weight more or less more than 20 kilograms, is that you can try put a CPAP or auto CPAP device and try to see if auto CPAP can work even if the child is under 30 kilograms. If it won't work, you will be able to use the CPAP device on constant pressure. Other trick is to use NIV standard devices, just because usually the flow detection is above 13 kilograms, and like this, doing constant CPAP, you will be able to get correct data. So that's a possibility. You doing CPAP with an NIV standard device. Concerning the choice of NIV, so once again, for infants, if the use is more than 16 hours per day, we will choose life support. Concerning infants, if the use is only during the night or the nap use, we will choose either life support or intermediate, but intermediate only if the child is well detected, because once again, as I said, if you want to do NIV with the possibility of the child to trigger the ventilator has to see correctly the flow. And you won't have the choice but life support if the infant is ventilated for because of life support conditions. So if it's because of like Ondine curse or other disease like this, you will put a life support anyway. Otherwise, you have to be sure that the patient is correctly detected by the device to propose an intermediate device for NIV. Concerning the child, if the use is more than 16 hours, we'll go for life support. And the same thing, if it's only during night and or nap use, we'll choose life support or intermediate. As the same thing, the child has to be detected to be capable to receive an IV correctly, to trigger the ventilator. And once again, if it's life support condition, you have to choose life support device. And for adolescents, same thing, intermediate if the use is more than 16 hours, except if it's life support conditions. Otherwise, we can go with the standard bi-level device if the use is only during the night, once again, except it's for life support condition. And the other way to see this is according to the weight of the patient. Once again, this is our practice. So we'll go with life support device for the children that are usually under about 10 kilograms, just to be sure that we'll have correct detection of the flow and so correct trigger of the device, and no problem of asynchrony between the patient and the ventilator. If the child weighs more or less more than 10 kilograms and has to use the ventilator for a long time each day, we'll go with a life support. And we can otherwise try intermediate device if the patient is correctly detected by the device. And if the patient weighs more than about 20 kilograms, we can try standard NIV device if there is only a few hours of use per night. As I remember, an NIV device usually detect the patient above more or less 13 kilograms, but if you want to be sure that you have a correct detection, you can go either with patient over like 15 kilogram or like over 20 kilogram if you want to feel more comfortable. What is important is that you have checked that the patient is correctly detected. And concerning humidification, there is, I think, no rules, but usually we recommend humidification systematically in infants and children. This is a comfort, but it may be very important to make the tolerance, acceptability of the treatment improved for infants and children, to avoid the dryness of the nose and the mouth. It's very difficult to know for infants or children that are not able to speak if they are comfortable with this level of humidification. What we can see sometimes in infants is that if the humidification is not enough, they will have kind of flu symptoms with the eyes that are like a little bit red or bright, and like the nose that seems to be a little bit obstructed. And by increasing humidification, if these symptoms are removed, that means that it was a problem of humidification. For the older children, it's easy because you can ask them if the mouth is dry or not, if they need to drink during the morning, if they have some difficulty to tolerate the air that is very too cold. And once again, you have to adapt humidification according to this information. This is considering comfort, but it can be very important, once again, to make the tolerance of CPAP and NIV better. And sometimes it can help to close the mouth just by if you are using, for example, a nasal mask, just by having a very good humidification, you will allow a better ventilation through the nose, and the mouth can be closed just by adjusting correctly humidification of the air. In adolescent, we usually always propose humidifier. We have not experience of adolescent not using it, but it is much easy to ask the adolescent, if he can speak, obviously, how does he feel without humidifier, and if everything is okay like this, the NIV or CPAP is well tolerated, you can do without, but our practice is to always propose. And as I said just before, this is important because that may reduce nasal congestion, therefore reduce mouth breathing. And this is an important point to make acceptance of CPAP and IV. You can also sometimes propose, because what is very tricky with humidification is that sometimes it will be too low, but if you increase the humidification, you will have some water within the tubing. And this is a big problem because the water within the tubing can arrive until the mask, and so until the nose and the mouth, and that's not a very good thing. So you can't increase too much the humidification because of the water condensation within the tubings, and so you don't have a solution. So possible solution is to try to adapt heated tubing, or even to try to propose a tubing cover socks, and in many cases it is enough to have a good humidification without having the problem of nose and mouth dryness or water condensation inside the tubing.
Thank you, Sonia. That's brilliant. I definitely know what type of CPAP machine or ventilator to use with my patients now. I really want to emphasize to the people watching the video today to look at the ventilator downloaded software and check that you can see if there is flow detection for your patients, because I think you brilliantly explained why that is so important. And I know that I probably have not paid enough attention to it, and it's possibly a mistake that other clinicians are making. And I also want to pick up on not only are your pathways great, but your tip about humidification is also key, so that you can find that patients can breathe better through their nose and keep their mouth shut, and that can help with leak is also a fantastic tip. So I'd like to thank you for your time and your contribution to the Education by Briaz series.